Hi there and welcome to another video from me, the History Tutor, and in this video I'm going to be looking at the AQA topic, Britain, Health and the People, and looking at the last question, the big 16 marker, the factor question. Okay, so in this video we're going for the big one, the 16 marker, the big factor question at the end of your exam. You'll be tired, a bit exhausted, but you can get really good marks. You can at least get 10 to 14 marks quite successfully. So I'm going to talk you through all the criteria to ensure you know what you're doing to get really great marks in this question and avoid the pitfalls that many people fall into. I'll then show you an example paragraph and talk you through it, and then we're going to go through the rest of the answer together. So find this in your revision guide. We're going to look through our 16 markers. So let's go for it. Okay, so here's our question. Has war been the most important factor in the development of surgery and anatomy in Britain? Explain your answer with reference to the role of war and other factors. Use a range of examples from across your study of health and the people from 1000 AD to the present day. 16 marks. So find this question in your revision guide and then start to list some ideas then. What do you think would be in the mark scheme? What is the success criteria for this question? What skill do you need to show? It's got has war. You've got to make a decision, have you? You've got to explain all that information in the second bit. What sort of things do we need to do? What sort of things must we do to gain the marks? So pause me now and have a good think about this. Okay, so here's some of the things you need to think about. So I would recommend, if you've got time, doing 3 peel paragraphs, 1 factor per paragraph. Okay, I'd recommend doing that. Just, you can get away with 2 and a conclusion, but those 2 need to be really good. Otherwise, you might not get the marks. Whereas 3, if you've got the time, means you can obviously have an extra paragraph in case one of them's a bit rubbish and not done a good job. And you can also be covering more of the time period and more of the ideas. We need to be aware this is a 16 marker. So if you're normal time, the rules in the exam tend to be the amount of marks plus half, again, is the amount of time you get per question. Have a look at the exam paper and do the maths, and you'll work out that ends up being exactly 60 minutes, which is how long you have for the exam paper. So you've got 24 minutes for this question. So, try and write as much as you can in that 24 minutes. So use the factor given and then obviously 2 other factors to form the basis of your paragraphs. This should not be a yes-no question. It's not yes, war's a good factor, no, war's not a good factor. That won't get you more than 8 marks. Okay, so you've got to talk about other factors. So the factors are war, superstition, religion, government, communication, science, technology, individual genius, luck/chance, although students otherwise do sometimes have other ideas as well in terms of factors, which normally can be okay if they're well argued, but these are the main ones to stick to. You must talk about the whole topic with examples from at least 3 of the 4 time periods. Now in my revision guide, I've split it into the 4 time periods. You've got medieval, Renaissance, you've got the 1800s, and you've got the 1900s. So those are your time periods. So make sure you're following those time periods in your answers. So try and have an example from at least 3 time periods. Normally the exam board wants to see 3. Recently, they've had a couple of tricky questions. They've accepted 2 time periods, but normally it's best to cover 3 time periods across your answer. So explain how the factor led to an improvement. All too often I see students listing examples without explaining the impact. So we've got to explain how it developed surgery. So if you're going to say war, and then you're going to talk about an example of a war, you've then got to say this developed surgery because. So everything needs to be example, impact, example, impact. You need to explain in 2 to 3 sentences your ideas. Evaluate the factor as well. Remember, you're trying to say was war the most important. So if you're saying war is, then I expect to see a furthermore. You need to say, yes, it's important with an example explained, and then give another one to really highlight its importance. If you think another factor is less important, maybe talking about religion, maybe, then say something good about it, then say something bad to highlight it's not as good as war as a factor. And then, of course, because we're making a decision, we need to have a short conclusion at the end, rounding off your ideas. Okay, so let's go to some planning now. I've given you 3 factors here, war, individual genius and religion. Now you might have different factors in mind, but we're going to work with these ones because I think they work in terms of giving a spread of time periods You might not think religion is a very good factor. However, if you want to talk about the medieval time, you need to include religion, possibly for any factor question, really, because it's the most important factor in that time. And there's some nice, easy examples and easy wins to talk about with religion. So this isn't about what you think is the correct answer. It's about getting marks in your exam. So it's a bit of a game to play. So just remember that. Okay, so let's think about war, individual genius, and religion. So pause me now, have a look through your revision guide and see if you can find some really good examples of these factors helping to improve surgery. And if you've worked through the tasks in my revision guide with the planning tables, you might already have some ideas ready. Okay, so here's some of my ideas then. So I've got war with Pare using his herbal oil. He was a bit unhappy cutting on people's limbs and all the pain, so he started to come up with some ideas to improve things. So the herbal oil is helping the wound heal rather than pouring that burning hot oil all over that gunshot wound. The crow's beak then is controlling bleeding. Now bleeding was one of the major problems they faced, so again now you're clamping the wound closed rather than putting the hot cautery iron on the amputated wound, and people might die of shock. So really great improvements, and obviously those improvements were shared in Britain by Close translating and developing his book. Muckendo, during war, developed plastic surgery and skin grafts. We've also got a bit of a however that these people could be considered individual geniuses, of course. So war has led to their changes, but they're also geniuses in some ways. So therefore, you could link to individual genius second paragraph in Pare. You've got crow's beak. He's invented that from nowhere, come up with that idea himself. That is a sign of genius. Lister realised carbolic acid could be used to stop infection and developed aseptic surgery. Vesalius proved Galen wrong 200 ways and ended Galen's dominance of anatomy ideas that were so incorrect. So there's lots of genius there. Then we've got religion. Christian Church helped to develop surgery by employing barber surgeons to bleed people and led to their training in monasteries, but also in universities. We've got Arab surgeons. Avicenna wrote the canon of medicine and started to develop anatomy knowledge, even started to question Galen's ideas to some extent. And Arab doctors taught Western doctors to abandon the idea of praiseworthy pus and clean the wounds to try and stop infections. So we've got really big religious ideas to talk about as well. So what does this look like if we're going to answer a question around this? So here's the example paragraph. So we're going to make a point. So we're going to say, war was quite important to development of surgery and anatomy in Britain because it gave the opportunity for surgeons to try new ideas. Now, I don't think it's very important because I'm going to be arguing maybe individual genius. As you've seen from the plan there, the people who made discoveries in war were also geniuses. So we could argue that. They did develop new ideas in war, though, and war sort of pushed people like Pare to make those ideas. So it's given an idea from Pare. So, for example, Pare uses herbal oil to help patients with gunshot wounds due to war. Here's the really important bit. We've got to explain the impact of this. This is where candidates go wrong. If you don't explain impacts, you're not going to get more than 8 marks. So you must do it. So this helped surgery develop in Britain as, okay, so that's your link to the question. Just put that in every time. Put the link to the question in, then explain. This helped surgery develop in Britain as his herbal oil helped bullet wounds heal better than using burning oil, and this reduced the death rate. William Close then shared Pare's ideas, which made Pare important in Britain. So people are not dying of the pain of the burning oil now. They're having a nice herbal oil and having a relaxing time recovering. Well, as relaxing as it can be. Let's go to another idea. Furthermore, due to the shell injuries in the First World War, Archibald Muckendo developed the first skin grafting technology. So this developed surgery as by using skin tubes to cover holes in the face, he started to develop the first types of plastic surgery. So we got that impact. And we said in our planner, however, considering the huge numbers of wars, surgery did not improve that much due to them. Pare and Muckendo could also be seen as individual geniuses rather than simply due to war, as they have sort of invented new ideas, haven't they? Secondly, individual genius is a very important factor in development surgery and anatomy in Britain okay, so we're going to work through this one together. So in your revision guide, you can start writing your answers. So finishing off this point, how would you finish this sentence? Why are individual geniuses so important? So here's what I've gone for. So obviously individual geniuses are very important in development surgery and anatomy in Britain as they develop new and original ideas to improve surgery. So that's exactly the idea, this inventing ideas. So can we give an example? So come up with an example now. You can use Pare again if you like. We have covered Pare so far in the Renaissance. We've covered also the 1900s with the war. So we're covering a range of time periods quite nicely. We know we're going to go to religion in the medieval time. So we're going to cover 3 time periods quite nicely. we can use PARE again. We don't have to panic about using that time period. So go to PARE if that's the easiest example of inventing things. Okay, where you go. I've said, for example, PARE also invented the crow's beak tool and brought back the ancient idea of the ligature. So how did this develop surgery? This developed surgery because, so can you explain the impact of this? What does it do, this crow's beak and ligature? What's it stopping that was the problem of this time period? Okay, pause me now and have a go. So I've said this developed surgery in Britain as the crow's beak stopped the bleeding after amputations and allowed a ligature to be used rather than a painful cautery iron. This was shared with Britain in the book Works on Surgery. Can we do it furthermore? Can we link to another individual who's come up with an amazing idea that's really benefited surgery? Because have a think, we had Lister in our plan, didn't we? So maybe use him. Okay, away you go. So I've said, furthermore, individuals were important as Lister made the great discovery that carbonic acid could stop infections within surgery. I've then explained his impact. So he used this from age 65 in his operations and his death rate dropped from 45% to 15%. This further showed the importance of individual genius as this discovery would eventually lead to aseptic surgery that included metal tables, scrubs and rubber gloves to stop bacteria within surgery. You could have also said he's a genius for realising Pasteur's ideas. We could have even used Pasteur as our idea. Let's finally go to religion then. Go for this yourself. I'm not going to talk you through each sentence. Have a go at all the paragraph. And remember that key thing of this developed surgery because once you give an example, explain its impact. That's where the marks are going to be. So if you can explain a range of factors, explain a range of time periods, and give those developed impacts, you can get 12 marks out of 16 really easily. So go for it now. Here's my idea then. So I said, finally, religion was somewhat important factor in development of surgery and anatomy in Britain because religious training helped to improve medieval surgery. So, for example, the Christian church encouraged development of barber surgeons. The church employed them in their monasteries to bleed patients. This developed surgery in Britain because barber surgery developed due to this, as it then became a trade on the high street. This meant they had to form a guild. So if you're on a high street in a medieval town, you have to have a guild, and then you had to be trained for 7 years before you became a master. So that meant they had 7 years of apprenticeship training to develop their skills. Also, the Christian church set up universities like Padua, and you could also mention Montpellier. This all led to the quality of surgeons improving as they had to have more training. You could say about Islamic doctors as well. Furthermore, Islam helped the development of surgery. Islamic doctors believed that Allah provided all the cures on earth, so did not believe in spiritual cures as much. This led to Arab doctors teaching European doctors on crusades to abandon ideas like praiseworthy pus. This improved surgery as people began to clean wounds and reduced infection. Okay, so hopefully you've managed to explain your impacts. You can see there, example, impact is how I'm setting up my idea. Finally, you need a conclusion. So if you have covered your 3 factors, your 3 time periods, and you've explained your examples, and you could expect 12 marks. If you've started to give some howevers in there, you might expect a few more marks, and then you need to round it all off with a conclusion to get the last few marks. And this is where, again, we can give our strengths and weaknesses. So we want a conclusion that's saying how important war is. It's only somewhat important and a reason why. Then we can say individual genius is far more important and say why it's more important than war. And we can say religion's quite important and why it's only quite important. Okay, so we can round off our ideas with some evaluation in our conclusion. And hopefully by giving some comparison and evaluation, we'll gather a few more marks towards those top marks. Okay, well, I hope you found it useful going through that fact question. It's obviously a really challenging question, particularly at that phase of the exam when you're maybe a little bit tired. So remember some of those tips about time, 24 minutes, about your different number of factors and time periods, and to obviously explain your impacts. So if you found that useful, do subscribe to my YouTube channel and also look out for my revision guide. It has more factor questions in it and has more questions for you to work through as well. So do have a look at the notes in my YouTube video to my Amazon channel. Okay, hope to see you again soon. Bye for now.